Hello and welcome to all of you. In this video, we will talk about the various questions asked in your Grand Test 12. Myself, Dr. Saurabh Bhatia, your pharmacology mentor at DBMCI. Starting with question number 1, which of the following is used as a carrier in anesthetic agent? So we know that nitric oxide is a medicine that has a capability to cross the membranes at a very fast speed. So this medicine is mainly used as a carrier. Although this is not a very good anesthetic agent, but along with other medicine, this will help the other medicines to start their effect very early. So this medicine is always used as a carrier along with the other anesthetic drug. So answer is nitric oxide. Moving on to question number 2. A patient complains of excessive thirst and increased urination, and he drinks a lot of water per day, and he has got a history. He is having a history of cerebral trauma. So because of cerebral trauma, he may have got the injury to the posterior pituitary, and because of the injury to the posterior pituitary gland, his antidiuretic hormone is not getting released. So when the antidiuretic hormone is not released in his body, he may be having loss of water. He may be having a loss of water from his body. That's why he is feeling excessive thirst. He is having the water deficiency in his body. So here you people have to give some drug that will act like an antidiuretic hormone. And we know that the other name of antidiuretic hormone is a vasopressin. So desmopressin is a medicine that will act on vasopressin 2 receptor. So by acting on the vasopressin 2 receptor, this medicine can retain the water and this will act like an antidiuretic hormone. So this is the best answer. It's a drug of choice for this condition where the patient is suffering from ADH deficiency. This is also known as diabetes insipidus. We also call it central diabetes insipidus. Now for hydrochlorothiazide, which is a type of a thiazide, this is a drug of choice for nephrogenic diabetes insipidus. So this is a case of the question. The question is based on central diabetes insipidus, where the drug of choice is desmopressin. But for nephrogenic diabetes insipidus, thiazides are the drug of choice. Tolvaptan is a medicine which is a V2 receptor blocker. It's not an inducer, it's a blocker. This is the drug of choice for SIADH, where the patient ADH level is excessively high. So question number 2, answer is desmopressin. Moving on to question number 3, a patient has come to you with arthritis, peptic ulcer disease, and also have the carditis. Now, what is the most appropriate anti-inflammatory drug we can give? And now, because of the peptic ulcer disease, we cannot give these medicines which are the non-selective COX inhibitors. So non-selective COX inhibitors are the one which are inhibitor of COX-1 and the COX-2 enzyme. So these medicines cannot be given for the treatment of peptic ulcer disease, patients who are having the peptic ulcer disease, because they can further aggravate the peptic ulcer disease. So medicines like ibuprofen, diclofenac, naproxen. So this is a naproxen. So naproxen, diclofenac, ibuprofen, these medicines cannot be given to a patient who is already having a peptic ulcer disease. So celecoxib is a one which is a selective COX-2 inhibitor. So this medicine is a selective COX-2 inhibitor. This medicine can be given to this kind of patient. So non-selective medicines, by inhibiting the COX-1, stop the prostaglandin E2 synthesis and can result in increased risk of peptic ulcer disease. This is not a case with a selective COX-2 inhibitor. So question number 3, the answer is D, Delhi. Moving on to question number 4, a patient with CKD presented with severe anemia. Lab tests have shown the normocytic normochromic anemia. So this is the anemia associated with CKD. Now, CKD patient, why the patient will develop anemia? Because of the deficiency of the erythropoietin. We know that erythropoietin released by the kidney. So in patients of kidney failure, erythropoietin is not released and the patient will have the anemia. So which medicine can be given as a most appropriate treatment? Answer is darbepoetin. So darbepoetin is an artificial erythropoietin, can be given to this patient for the treatment of this anemia. It's a drug of choice for the CKD anemia. So question number 4, answer is C. Moving on to question number 5, a 50-year-old patient weighing 70 kg given a drug with a half-life of 3 hours and the volume distribution is 100 ml per kg. What is the approximate clearance? So here we have to use the formula for the T-half. So T-half formula is 0.693 multiplied by volume of distribution divided by the clearance. Now here we can find out what is clearance. The clearance is given by the 0.693, and what is the volume of distribution? The volume of distribution in this case is 70 kg multiplied by the 100 ml. So 100 ml per kg. So 70 kg multiplied by 100 ml will give you the total volume distribution divided by the half-life. Half-life is 3 hours. Now after solving this equation, like instead of writing 3 hours, I can write it 180 minutes because we have to find out our result in minutes. So then this will come out to be approximately 26.6 ml per minute. That is equal to 27 ml per minute. So answer to this MCQ is D, Delhi. 26.6 ml per minute is equal to 27. So answer is D daily. So you have to just put uh, one formula for the half-life, and here you can find out the answer for the clearance. Question number 6. A 39-year-old male presented with symptoms of stress and inability to manage work-life balance. Blood pressure is very high. So it's a young patient. The blood pressure is very high. Which medicine is given? So whenever the BP is more than 140/90, we have to treat the patient. This patient BP is very high, and also he is a young patient. So young patients may high BP. We always start with ACE inhibitor ARBs. So ACE inhibitor ARBs are the medicines, like the telmisartan is one of the examples. So these medicines are the best medicines for the young patients. In old patients, we prefer to give calcium channel blocker. In young patients, we give ACE inhibitor ARB. We don't advise the patient for the rest because this patient is having a significant high BP. We cannot tell the patient only to go for the conservative management. So question number 6, answer is B, Bombay. Moving on to question number 7, a patient has visited the hospital with the black discoloration of the buccal cavity and the nasal area. So he has got a condition known as mucormycosis. So patient has got a mucormycosis, and this is seen after having a steroidal therapy. So which is the most suitable treatment? So mucormycosis, the drug of choice is amphotericin B. So amphotericin B, drug of choice for mucormycosis. And for the mucormycosis, this is not given alone. So liposomal amphotericin B given always with posaconazole. So it is always given with posaconazole, and it is also the drug of choice for cryptococcal meningitis. So this medicine is also a drug of choice for cryptococcal meningitis, mucormycosis, two very important indications of liposomal amphotericin B. Voriconazole is a drug of choice for invasive aspergillosis. So this is the drug of choice for invasive aspergillosis. This is the drug of choice for that condition. So question number 7, answer is D, Delhi. Moving on to question number 8, complicated malaria due to endemic Plasmodium falciparum. Now it is resistant to chloroquine. What is the treatment in first trimester? So whenever the patient is having a complicated malaria, whether the patient is pregnant or not pregnant does not matter. We have to give artesunate as the best medicine. So artesunate is given by the IV route. So this medicine is always be the best medicine for both pregnant and the non-pregnant patient, right? In case of uncomplicated falciparum malaria, for uncomplicated falciparum malaria, if the female is pregnant, for uncomplicated falciparum, if the female is pregnant and she is having an uncomplicated malaria, then in first trimester we give quinine. And in second, third trimester we give the artesunate therapy. So we give the artesunate therapy in second, third trimester. So on the precautionary side, we don't give medicines artesunate in first trimester because the risk of teratogenesis is high. But when the malaria is complicated, then we don't take a chance. We give artesunate to this female because we have to save the life of this female. So question number 8, answer is C. Now women is taking cetirizine for allergic rhinitis and she is complaining of excessive sleepiness. Which of the best alternative we can use for have a minimum sedative effect? So answer is fexofenadine. Fexofenadine is a generation 2 medicine, and all other are generation 1 medicines. Generation 1 medicines have more risk of sedation. So we cannot give these medicines to patients who are involved in critical work like the drivers or the electricians. They will cause lot of sedation, generation 1 medicine. So here the best medicine is a fexofenadine that we can give, which have a minimum risk of sedation. Generation 1 medicines have sedation problems. Second, they have the short action. So these medicines have the short action. They can cause sedation as well. And these medicines also have the anticholinergic property. So they have the anticholinergic property. These kind of things cannot be seen with the new medicines like fexofenadine. So question number 9, answer is C. Now question number 10, which is a preferred pre-operative drug that is given to manage the BP of the patient in Pheochromocytoma. It's a fact-based question. Phenoxybenzamine is the best medicine. So phenoxybenzamine is a non-selective alpha blocker. This is a type of irreversible alpha blocker. So this is a type of irreversible alpha blocker, long-acting medicine. It's the best medicine for Pheochromocytoma. Right? Prazosin we can use in patients of scorpion sting. So in patients of scorpion sting, we can use prazosin. Labetalol is the best medicine for the pregnancy-induced hypertension. So pregnancy-induced hypertension, labetalol can be used as a best medicine. So question number 10, answer is B, Bombay, phenoxybenzamine. Moving on to question number 11, a 12-year-old patient come to with palpitation. Patient ka heart rate is high. He is also having a tremors, dry mouth, tachycardia. So he is having an anticholinergic property like the dry mouth and tachycardia. Respiration is high. Which substance toxicity can be seen? So answer is tricyclic antidepressants. So tricyclic antidepressants are the one. These medicines have anticholinergic property. These medicines can also have a high risk of toxicity. So these medicines can cause tachycardia, medicines can cause arrhythmia, medicines have dry mouth as an anticholinergic manifestation, can cause toxicity commonly. So this is seen as a best culprit over here. And here we have to give the antidote, and the antidote of choice for this condition is sodium bicarbonate. So sodium bicarbonate is the antidote of this condition that is given to this patient. When opioid toxicity, respiration rate will be low. And in lithium, we don't have these kind of symptoms, right? So propinolol mein heart rate will be low, not high. So here the best answer is TCA poisoning. Now let's move on to question number 12. Question number 12, a patient has developed the Achilles tendinitis and leg swelling after taking a certain antibiotic. Now, which adverse effect is commonly associated with fluoroquinolone? Okay, this adverse effect is seen with fluoroquinolone. It is a tendinitis. What is the main mechanism of action? This is a fact-based question. This is a DNA gyrase inhibitor. So we know that fluoroquinolones are the DNA gyrase inhibitor. So question number 12 answer is A. Right? Now fluoroquinolones, because they can cause tendinitis, they cannot be given to the pregnant females. So these medicines cannot be given to the pregnant female because of the same reason. Now moving on to question number 13, the patient has taken some drug and that has caused the QT prolongation. And he has taken the medicine for respiratory infection. Which drug is responsible? Answer is erythromycin. So erythromycin can cause QT prolongation as a side effect, but more side effect of medicine is a diarrhea. So this medicine can act on motilin receptor. By acting on the motilin receptor of the GAT, this medicine can increase the peristalsis given for the treatment of diarrhea for this patient. Last question, question number 14. The patient has got some gram-positive cocci infection that will bind to D-alanine side chain. What is the drug that is responsible for this? It's a fact-based question. They have given the target. So vancomycin is a medicine. This medicine is a glycopeptide antibiotic. This is the medicine that is a cell wall inhibitor. It's a cell wall inhibitor by acting to the D-alanine side chain. And this is the drug of choice for MRSA. So this medicine is drug of choice for MRSA. Question 14, answer is B, Bombay. These are 14 questions asked in your exam. In case you have further any doubt, you can contact me directly or you can tag me in the Telegram group. Thanks for watching this video.